Hello everyone, welcome back to my channel. If you are new here, I am a public health professional, and through this channel I try to educate people about the field of public health and how to navigate your career in this field and also have a little fun at the same time. In my last video we talked about the two sectors of public health that you could make money in and also add value while following your passion. In this video, we're going to be talking about the rest three sectors, i.e. the non-profit sector, the academic sector, and hospitals and medical facilities. If you haven't had a chance to watch that video already, I will link it down below in the description box for you to go and check out. I definitely encourage you to watch that video first, since it lays the foundation for this video, which I won't be repeating in this one. So without further ado, let's jump right into it. So for the first one, we're going to be addressing the non-profit sector. So jobs in this setting often focus on a particular population, such as minorities or mothers, refugees or immigrants, racialized communities, or particular health disparities. There are lots of NGOs working at local, national, or international levels on global causes that unify the overarching goal of the public health industry. On the other hand, there are also NGOs that work for a specific niche area or cause, like a particular population, a particular disease, or a particular social cause. Depending on what you're passionate about, you could find an NGO that fits your area of interest and work with them to contribute to the field. For example, if you're interested in children's health, find an NGO whose mandate is around children's health and work with them. If you're interested in women's health, find an organization whose focus is in that area, and so on. Another good part about this sector that I really like is no matter what country you're in, whether they have a public health infrastructure or not, irrespective of that, you'll definitely find NGOs as a thing in your country. I don't believe there's any country where there are no NGOs. So I definitely feel if you are in a country where there's no good public health infrastructure, this is a good way to get your foot in the door in the industry, in the field, get a feel of it, and navigate your career path from there. Lastly, the beauty of this sector that I really want to highlight is whether you're a full-time student, full-time working professional in whatever field, in order to work for an NGO or a non-profit organization, you don't really need to quit your job or your studies to do so. You could easily be volunteering with them part-time. They would love for any help at all whatsoever. And you could contribute to the field in the same way and figure out your passion area of interest. Next, we have the academic sector. Needless to say, this includes all the colleges and universities that you could be working in as a public health professional. So, public health professionals working in academia typically focus on research. In addition, they're also teaching students enrolled either full-time or part-time in public health related degree programs. So these are people who are well established in the field, and they often hold multiple positions within different departments of a particular university, or different positions across different organizations that typically include a public health organization and a university. Instructors in health sciences often blend research and education to teach about patient engagement, healthcare, and the current standards of practice. I remember one of my favorite professors of epidemiology during my graduate program used to tell me how she loved being a professor and a researcher at the same time, because being a professor allowed her to be grounded to the basics of the field and at the same time be in touch with the up-and-coming research of the field. A lot of times it so happens in any field that the more advanced we get, the further away we get from the basics. We don't forget the basics, of course, because our advanced knowledge is being built on the basics, but it is not unless we need to teach it to someone do we actually remember it for life. So yeah, that's definitely one of the perks that I feel is available to you if you want to get into academia and be a professor and a researcher at the same time. Another very important point to consider here is that you will need a PhD if you want to go for a professorship. So if you feel like you don't want to spend 4 to 5 years towards a PhD and want to work directly in the workforce, then it may be harder for you to get into academia. However, it's not impossible for sure. Never think that you can't do a PhD though, because if you can do a graduate or an undergraduate program and you have come out of it with a rather decent scores, then you can definitely do a PhD. So don't focus more on whether you can do it or not. Rather, I would say focus on whether you want to do it or not. So, talking about hiring. Employers from the academic setting hire from all aspects of this very broad industry, including scientists, researchers, analysts, policymakers, health economists, administrators, managers, information technologists, and other such relevant folks who are well versed in all the diverse fields of public health. This is also because in any given university or college which is offering a professional degree in public health, that degree will have courses that focuses on a lot of different areas of public health because it is so broad. Hence, they need experts to teach these courses, right? So even within academia, you really have so many different options again to tap into depending on what research area you're most interested in. So the last sector we have for this topic is hospitals and medical facilities. So hospitals are definitely not just a place for doctors, nurses, and pharmacists. Such medical facilities require some solid administration to be in place in order to make it run to its best capacity. If you are from a country that does not have a public health department in their healthcare system, you will find a lot of public health related work being done through hospitals, either public or private. So, along with administrative expertise and public health training, hospitals also closely collaborate with social workers to bring their expertise working with the actual community, understanding patients' other healthcare related needs, doing outreach work or field work, connecting them with counseling services, helping expand and strengthen their social support network, and coordinating needs for medicine, therapy, nursing, and other programs and services. Lastly, for this video, we're going to be talking about what are some of the common public health jobs available in this field. While way too numerous to list here, public health jobs do cover a variety of areas including epidemiology, biostatistics, environmental health, health services administration, and many more. Here are some of the public health careers that you can pursue with a public health degree. You're free to go back and have a detailed look if you want. I would warn you though to not get too tied up into the job titles because job titles are really up to the organizations to make up, and sometimes even there are HR constraints which decide on what sort of job titles could go for certain job postings within their organizations. So I'd say focus on what kind of work you'd want to be doing by looking at the job summary or the job description, and keep the job title as a secondary thing in your mind when you're looking for work in public health. Alright, that brings us to the end of this video and on to the last bit of our quote for the day. So today we have, strive not to be a success, but rather to be of value. I'd like to just expand on this by saying that there's nothing wrong in being a success or wanting success. Of course, you want to be successful, but don't chase that. Instead, focus all your energy into being valuable to your boss, to your team, to your organization, to the field you're working in, and ultimately a little bit to the world as well. When someone finds you valuable, success will follow along because that'll help you climb the ladder and progress in your career. So strive not to be a success, but rather to be of value. Alright, that is it for today. I hope you liked this video and found something valuable out of it. Please do give this video a big thumbs up and hit the subscribe button if you haven't already subscribed. Thank you so much again for joining and giving me your time today, and I will see you in my next video. Bye-bye.